Bovine Ephemeral Fever, BEF. It is also called 3-day sickness and is caused by an arbovirus and transmitted by flying, biting insects, most likely mosquitoes, affecting cattle and occasionally buffaloes. It is mostly sporadic in hot and humid areas. Outbreaks of disease occur during or after periods of heavy summer rainfall, as it is most prevalent in the wet season in the tropics and in the summer to early autumn in the subtropics or temperate regions. The BEF virus can survive in the winter on vectors. It is a transboundary disease that may spread from one country to another by wind and live animal trading. Causes: BEF is an arthropod-borne arbovirus known as ephemeral fever virus or bovine ephemeral fever virus. A banded mosquito named Culex annulirostris is a vector of BEF virus. Signs and symptoms. There are typically 3 recognized stages of bovine ephemeral virus. The acute febrile stage appears suddenly and is especially noticeable in dairy cattle. The second stage is muscular stiffness and lameness in one or more limbs. Some secondary bloat may occur due to general inflammation of the abdominal cavity and ruminal stasis. During recovery, most affected animals resume eating and drinking. Animals may go down, with heavy animals in good condition being most affected. Animal shows the signs of rapid and significant decrease in milk production, rapid onset of fever from 100 min to 105. Lactating cows can dry up completely, and stage may abort. Animals quit eating and drinking and develop depression. Affected animals may shiver, become very stiff with shifting lameness, and are reluctant to move. Or prolonged recumbency leading to Downer syndrome can occur. Temporary or permanent paralysis may occur as a result of damage to the spinal cord. The joints may appear swollen, and sometimes there is swelling around the jaw, typically drooling of saliva. Produce stringy nasal discharge. May have watery eyes. Male bulls may be temporarily infertile. Diagnosis: when an outbreak occurs in unvaccinated cattle, not previously exposed to the virus, a diagnosis of BEF can often be made based on clinical signs and the brevity of illness. However, when most animals are immune and occasional cases occur, or when there are cases in areas where the disease occurs less frequently, laboratory confirmation of the cause of illness may be required. Diagnosis can be based on 1. Various serological tests, 2. Serum neutralization test, and 3. A blocking ELISA analysis. Treatment: nursing care. Animals that have gone down should be provided with adequate shelter, water, and food, as cattle left exposed in hot weather are much more likely to die. BEF can impair the swallowing reflex, so affected animals should not be drenched or force-fed. Handled stock benefit from being rolled over several times a day to help avoid loss of circulation to the underside limbs, which will result in permanent muscle damage. Anti-inflammatory drugs are recommended for recumbent animals and would be useful for clinically affected animals. Calcium injections, if given early in the course of the illness, can be very effective in helping an animal regain its footing. Prevention. There is a modified live vaccine for prevention of BEF that provides long-lasting protection. To achieve long-lasting protection, 2 doses are required. The ideal is to give the first dose before disease occurs in the district. The second dose is then given at least 4 weeks later. The second dose can be given up to 6 months after the first dose. Animals can be vaccinated from 6 months of age and should then be revaccinated each year at the start of summer to ensure continued protection. Proper fly control would help to reduce the disease. Complete rest is the most effective treatment. Recovered animals should not be stressed or worked for some days since relapse may occur.